Welcome, everybody, to the Making Money Personal podcast. I'm super excited about this episode because it's a little different from our prior episodes. This episode is going to be the launch of our Share 'Cause You Care campaign, and it's right in the heart of the giving season. As you know at Triangle, one of our core values is community. And what better way to show support for your community than to highlight the nonprofits working so hard to support those in need in our communities? So, this Share 'Cause You Care campaign is a perfect way to do that. That's what this campaign's about. Share 'Cause You Care is a campaign to help raise money for nonprofit community partners. This year's contestants are Home Health and Hospice, Nashua PAL, and Hope Recovery. Triangle is giving each contestant a donation prize, and it's up to you to help us. We're asking our podcast followers, our social media followers, and any nonprofit supporters to vote for the organization that they think should receive the top donation. The one that receives the most votes will win. Our top donation prize is $1,000, and prizes 2 and 3 are both for $500. If you want to participate, here's how you vote. Visit trianglecu.org for the voting form, and you can vote daily. The contest runs from November 20th to December 4th, so make sure that you share with your friends and your family. This episode will feature 3 exclusive interviews with reps from each one of these organizations. They're going to share a little bit about their mission, as well as the important work that they do to touch the lives of the people living in our communities. Enjoy. Welcome, everybody, to this exclusive interview with Barbara LaFrance from Home Health and Hospice. Thank you for joining us, Barbara.
Oh, thank you for having me today.
So you're one of our 3 contestants for Triangle's Share 'Cause You Care campaign. We're super excited to have you on. The purpose of this interview is for you to share with our listeners a little bit of information about your organization and what you do for the community. So let's just get started right off the bat.
Sounds great.
What's the mission of Home Health and Hospice?
Yeah. So our mission is to provide patient-centered home health and hospice services to enhance the quality of life at every stage. So if you think about that, our home health services provide care with nursing and therapy from the gap from hospital to home. And our hospice services provide comfort and support so you can enjoy life for the time you have left.
Mm-hmm. Gotcha. And how long have you worked at Home Health?
I have been there for 25 years.
Wow.
I'm a nurse by background.
Very good.
Yeah, and I'm just honored to work there. It's a wonderful mission, and I'm so glad to be chosen as one of your 3 contestants today.
We're super excited you're here. So can you share a little bit about a story from your mission while you're working there? Like, is there something that's particularly touching for you? Maybe a story that you've experienced while working with the
I think the biggest story is how many individuals that we impact in the community. And so I've worked as a nurse in a lot of different settings, and I've met, people that we've cared for before, but we touch so many individuals because of our hospice services. It's just mind-boggling to think about those people. So no matter where I am, if I'm at a soccer game or if I'm in the dentist's office or anywhere, people will tell me a story about how they've been touched by our services, especially our hospice services. If you think about somebody that has passed away in your own life, you think about that one person, but that circle of friends, family, co-workers, and anybody, and we help support all of that circle of individuals through end-of-life care. And so that is just so impactful. So it's just humbling to work at Home Health and Hospice Care because we make such a difference in the community and we touch such a breadth of individuals. So at first when I started working there, it was almost like, oh, I'm hearing all these stories and you weren't prepared for it. But now it's such an honor and a privilege and humbling to do this work and know that we help the community, with their health because death impacts everybody.
Yeah, it's such important work. I feel like, we think a lot about very obvious needs in the community. We think of poverty, we think of, food insecurity and all that, but home care isn't always the first thing I think people think about when it comes to a community need. So with all of the people today who are in need of that, you guys provide a very valuable service.
Yeah, there's no place like home.
Yeah,
right?
Yes, 100%.
Right, and so you want to be out of the hospital as soon as possible And we're there to fill that gap, to teach you how to, with your illness or your injury or end of life, we're there to help you and support you so you can care for yourself at home and be home as soon as you want to be.
Yeah.
And so that's so important. And people don't think about it till they need it. But whether you're recovering from knee surgery or hip surgery or whether we come in and our therapists get you better so you can be independent and home again where you want to be.
Yeah, yeah. And you have professional nurses, professional medical professionals as on staff, right?
Oh, yes. We have physicians.
Wow.
Yeah,
very
and
cool.
nurse practitioners, and we have nurses, and we have therapists, physical therapists, occupational therapists, and nursing assistants. So if you need that little extra care for activities of daily living, our LNAs will be there to support you.
That's fantastic. So tell me a little bit about the history of home health and hospice.
Yeah, so we date back to 1883, 1893, yeah.
Whoa.
So our Good Cheer Society, who still is generous for us today, started working with mill-working families, helping them, bringing them food or bringing them flowers, and they realized a need for nursing care. And so they brought in the first visiting nurse in the area, and that is our history. So we developed the home health VNA services, and then hospice was introduced in 1970 because there was a growing need and expertise for hospice end-of-life services. And so we adapted to the need, and we started hospice as part of those services. In the year 2000, we had our opening of our hospice house.
Okay.
So we generated funding, and we created our hospice house, which is now a 16-bed hospice house, thanks to an expansion in 2 years ago.
Wow. And is that based in Nashua
That's in Merrimack.
or Merrimack?
Yep.
Awesome. Wow, that's great.
Yeah.
So you're growing then in terms of the benefits you can provide, right?
We're growing because the community is growing, right?
Yeah.
This area is growing, and everybody wants to age in place. And so that's where we come in, right? And it's wonderful. And we take individuals regardless of their insurance, which is important to understand. And we will care for you, whether you're in a shelter or in a hotel or in a residential. So that's why we need the support of donations like the credit union.
It's great. Well, that's why you're on here, so we can spread the word, about what you do. I personally have had many family members who have received in-home care as well as hospice care. So it is such as a family member, it is very nice to know that there's such a group of people out there that are willing to help, willing to provide this service in a very caring and supportive way, because there's nothing more than seeing your loved one who's dealing with an illness or dealing with aging. There's nothing more pleasant to see than them being taken care of well, and really cared for. So thank you for the work that you do.
Oh, thank you. You bring up a great point, and I think that when you're in a hospital setting or in a homes and like a doctor's office, the family isn't affected as much, but we really work with the family because we walk into your home and the family's there, or in hospice, where you're touched by the family. And it's so important, illness and injury of a loved one, the family is affected.
Yes. Yeah, it can be very hard on them, in terms of providing the care, providing the support. Like my nanny, my grandmother, she's 93 years old right now, and she's receiving in-home care. It's not hospice care, it's just in-home care because she's got medications she needs to take. Her mobility is not so great, so she needs assistance, getting around. And so there is an in-home caretaker that comes in and helps her do those things. And because most of her children have kind of moved away, like she doesn't live near us, she doesn't live near a lot of family. So it's nice that we know she's getting that care in this time,
Yeah, you're right. It is. It kind of fills that gap.
Yeah.
And you're comforted. And now with technology too, there's availability for us to do remote monitoring and more utilize technology within the home setting, which also brings more comfort to families that can't be there.
Yeah. So if someone's interested in reaching out to you, they have a family member they're thinking of, getting care for, do they apply for it or just sign up?
There's so many ways. First, you can just call us. You can go to our website, and we have an inquiry right there. You can email us. You can call us. But we have transitional care teams that are out into the facilities, into hospitals, into nursing facilities, residential care, your doctor's office. So your doctor, anybody can make a referral. And I think that's so important to understand that we're just there. Just call us, or if you're in the hospital setting, they have case managers, and our nurses, our team, our transitional care team, will come in and meet with you one-on-one to talk about the services, and be there, when you need it, and tell you how to access our services. And so, yeah, just call.
That's awesome. Great. Okay, so if you could summarize it, what do you think is the greatest value? We've talked a lot about what your organization provides, but what's the greatest value you think you could say it provides to the community?
I think that there are other home care and hospice services, in our region, but we own and operate the Community Hospice House, which is the only hospice house within the region. And there's a reason, because it takes big community support and a very expert organization to run this hospice house. And that really provides that extra community value. So if you have, everybody wants to pass away at home, right? But if you can't, because of pain and symptom management or because of caregiver needs, everybody just needs a break. We have an inpatient facility called the Community Hospice House. It's 16 beds. It provides the same advanced care that you do have in the hospital setting, but it is a home-like setting. So it's, visitors come in 24/7. You can bring in your pet to visit. Family can stay overnight.
Nice.
I encourage everyone to look on our website and watch the video, because then you can see how wonderful that community hospice house is. And again, it's only because of community support and donations that we're able to maintain that community hospice house.
That's great. How many people do you serve within the community, if you could kind of...
Yeah, so you'd be surprised. We have over 6,000 patients a year.
Wow.
And so today, in one given day, we have in our home health services, so people recovering from illness or injury, getting better, independent in their home, we have 520 patients.
Wow.
So our nurses are going out and visiting, making sure they have their medications. Our therapists are getting them stronger. In our hospice services, which are in your home and in your nursing facilities or in assisted livings, we have 140 patients today.
Wow.
And when we have our 16-bed inpatient facility. Besides that, we also do community service groups. So we have foot care clinics that we go out into the senior centers,
awesome,
like here, and we provide foot care. And that is such an important service for the elders as they age, to be able to clip their nails and make sure they don't get an infection when they're doing that. And it's very social too. It's very fun. If you ever walked in, it's a fun place, believe it or not. And we also provide bereavement support groups to the community. So that's very important too. After a death, we follow patients, family members for over a year after a death, but we also open it up to the community who have had a loss. And we have support groups, because it's very important for you to grieve with people that have had other losses like you.
Yeah. Yeah, you feel like you're with people that understand what you're going through.
That's right.
You don't feel so alone.
Yeah, and it's a safe place, right? These support groups are a safe place to cry or grieve or be angry, and others understand exactly what you're going through. So it's a very important service that we provide.
Yeah. Now, you're based out of Merrimack. How far into the state do you serve?
We do all of Hillsborough County. So we're based in Merrimack, and it's really great because we're right off Everett, so that we can travel fast.
Yeah.
So we go out, if you think about the territory, we go out to Wilton, Mason, up to Goffstown, to our border's sort of Concord, and then we go east over Derry, Londonderry, Salem, and then to the border.
Wow. Awesome. Well, thank you so much for coming over and sharing a little bit about your organization. Sounds like you guys are doing great work. And you're expanding, you're growing, which is awesome.
We're growing with the community, and we want to be there for whoever needs us.
Fantastic.
Yeah.
Well, thank you for coming in. Really quick, again, you kind of covered how people want to get in touch, but let's reiterate that. So if people want to contact you guys, what's the best way to do that?
Yep, they can just go to our website, and our phone number's there. We have email contacts. So just call us if you need anything at all. Like I said, we're also available to come into the hospitals or nursing facilities. Our teams will just come in for one-on-one information and care. So give us a call, whatever you need.
Great. Thank you for, thank you for joining us. To everybody listening, if you like what you hear, they're one of our contestants for Share 'Cause You Care. So make sure you vote for Home Health and Hospice.
Yes, thank you. Vote for us.
Take care. Thanks, Barbara.
Thank you very much for having me.
Thank you.
Hi, I'm Terry Conley with Making Money Personal Podcast, and I am with Sean Nelson today from Nashua PAL. Sean, welcome to the studio.
It's glamorous. I love it here. This is spectacular.
We were just talking a little bit before we started recording about PAL's thinking about doing its own podcast, so that's super exciting.
We are in the beginnings of the youth perspective, is what we're going to call it.
Excellent.
Young people giving their ideas on how to solve big problems.
You know what? I think everybody should be tuning into that one. That one's going to be a positive one, you know? So, Sean, why don't we talk a little bit about Nashua PAL? Can you give us a little bit of a rundown on what the organizational mission is of Nashua PAL?
Nashua PAL, we are the Police Athletic League. So, cops and kids are our mission, strengthening cops, kids, and community. And our pillars are education, so that's making sure young people are going to school, being successful in school. Activities is the other, which is just getting out and running around, being active, being in sports, and we've got lots of sports within the organization.
Okay.
And then leadership, and that's everything else. That's encouraging, incentivizing young people to make positive change in their community with a goal of they will be the next leaders of our community regardless. So we're just making sure we give them the right skills.
That's awesome.
And then partnering with the police department is an adventure all the time. So
and
kids and cops together in a good way. In a good way.
I love that. So, and did you start off with a Nashua PD? Were you part of the Nashua PD?
No, I am the civilian end of the operation, always have been, but I know many of the officers very well. So that's really what PAL is doing. PAL is creating an opportunity for kids and cops to be together. I didn't know what I was getting myself into when I started with PAL 17 years ago. And some days I still don't.
Yeah.
But I am. We've been figuring it out and being pretty successful. Growing the organization, it's been a heck of an adventure.
That's wonderful.
Yeah.
So just in terms of the logistics of PAL, I see you at community events quite a bit, but where's your location? Like, do you have multiple locations in the city? Like, do the kids come together to, make that connection?
Yes, we're a little bit everywhere. So there are our base of operations at 52 Ash Street. Okay. So if you looked at Nashua's map and you layered in where just what is known as the Tree Streets, our center is located right in the middle of all that. So it's a tough community by New Hampshire standards and by many standards, but it is a spectacular place to be, and we're there on purpose, or we're not going anywhere. These are all the kids and families we want to talk to.
Yeah.
Then we have some space on a gymnasium on Main Street, and then many of our programs are just based within the city. So in schools, we had the largest elementary cross-country program.
Nice.
We have very successful football and cheer, street hockey, boxing, basketball. We're doing a little bit of everything. Anything that'll keep young people motivated and moving in the right direction. Because you don't get to do those things if you're not participating positively in the community.
Right, exactly.
So that's the hook.
That's awesome. So you're looking, basically it's like you're providing an outlet for these kids is it predominantly like after school programs?
After school, summer, when school's not in session, we are.
That's
usually.
wonderful. Yeah, keep them busy.
Yeah, and even on the weekends, it's a 7-day-a-week operation. Mm-hmm. There may be times where the center is closed, but usually that means that there's young people getting on a van and going somewhere, going on a trip, going to Beaverbrook, going to Silver Knights game, a Sox game, all those things, just keeping young people moving.
That's awesome. So, how many kids do you serve, and like how many kids are part of your program?
We're in the thousands. Wow. So about 2,500, I think, was the last count of young people that registered for the program, and then throughout the year we have a number of engagements that just open to the community.
Okay.
We're gearing up for holiday season now, so. Those will be in the hundreds of families.
Right.
And many of them may have one person that's a member of the PAL organization, and they have cousins and brothers and sisters and moms and grandmas that we're helping along the way.
Wow, that's wonderful. Just in terms of some of the programs, Sean, like, I can understand when you have team sports, you're kind of like developing a child to be a team player, right? Which is essential, especially when it gets to the work life. You all have to be a team player, right? But what about, like, are there specific steps that you're taking to develop their leadership skills?
All the time. That's the base of it. We are doing pretty in-depth interview with a young person when they first come in. We find out what's going well, what's going not so well, what are their aspirations, what are their goals. And for us, it doesn't matter if you want to be an astronaut, a doctor, a mechanic, whatever your goals are.
Yeah.
We just make sure you have some incentives to keep you moving in that direction.
Okay.
And then the leadership is happening on the field. There's some obvious team player, as you just described. But then you get a group of teenagers that you just, hey, how can we solve a community problem? And then they come up with, let's do a food drive. Let's help a neighbor. Let's go rake my grandmother's front yard. Those are all great ways to show that they're a part of the community.
Absolutely.
And all the evidence shows if you're a young person involved in a community that you'll more likely do the same thing when you're older and older and older. So,
right.
Old folks like me
can reap the benefits of the kids that you've had,
We're all part of the community. We're doing it together. Let's play together. Let's help together. Let's help each other. But let's have some fun along the way.
Oh no, I love the overall focus on community and being involved through National PAL. Like there's just so many elements that are positive about this program. You're helping the child, but you're also helping the community at the same time. It's wonderful.
That's when we know it's working. And
Yeah.
we have young people, so I've been with PAL for long enough to see some of those folks coming back with their kids.
Wow.
And now we're hiring some of those folks as staff. We're engaging them as volunteers, and that's when you know it's working. When
Yeah.
you got that next generation, bringing it up, the next generation of their kids, and
That's
it's
awesome.
been pretty fun adventure.
So speaking of personal, having that personal connection, is there one story that you can kind of share that's really been, a warm place in your heart?
I'm all warm. I'm sweating with how warm I am. We recently, so National PAL, there are PALs across the country. We just had Male Youth of the Year, came from Nashua. A young man, John, just graduated high school last year. He's going to be a realtor. I don't think I knew the impact we had on him until he was on stage in Memphis in front of hundreds of people talking about how many times he was kicked out of the PAL program because of his behavior. He described himself, I used to be a bad kid, he said. I used to be a bad kid. But we kept working with him. His mom kept dragging him back, so that was important.
Yes.
And he just talks about how important that was for him. And if he didn't have that consistency, the way he described it definitely was an emotional time for me, but also for the room. And then he's got little brothers now. They're in the program. And he is, if you ask many of our teenagers, what do you want to be when you grow up kind of conversation, some of them are saying, I want to be a realtor, like John.
Oh, wow.
So how quickly he went from what he described as a bad kid to a leader in his community.
Right.
And I can remember those moments when his name came up at a staff meeting and, okay, we're going to give him one more chance and one more chance. And we're doing a lot of that. You got to.
Yes.
That's part of the learning. Young
That's
people are
right.
supposed to bump into stuff and make some mistakes and hopefully learn from those things in a positive way.
Right. And then we kind of, as a community, guide them back into the fold a little bit or whatever.
it.
Yeah.
Make some connections. Hey, and it's great to have access to the community, too. If we have
Right.
somebody that wants to get in politics, I'll call the mayor's office. Can we get a conversation with a kid? And it's pretty accessible. The leaders in our community are pretty accessible.
Yeah, that's wonderful.
Yeah.
So, and speaking of that, do you have an element that's where you're doing internships? Do you get to that point where you are placing some of these kids so that they can do some shadowing and stuff like that?
Yeah, it used to be called Tuesday Tours. Now it's maybe Friday Drives. But the concept is just bring young people to meet leaders in the community. So if you are an artist in the community and you want to talk to kids about art, we got kids who want to learn about art. And they don't just learn about being an artist, they learn about the logistics to it and what it takes to run a business around it and how do you feed your family with that kind of activity. And so we're doing that with all kinds of categories of employment. And then we're always bringing people into the center to
Nice.
talk. So
That's awesome.
successful people
Yep.
speak differently than unsuccessful people. So you
Right.
bring in some successful folks, and then our young people learn a little bit from them, and then we just feed that fire.
Excellent. So, just in terms of the Share 'Cause You Care contest that we're having, how can obviously we're going to encourage people to vote for your organization,
Sure.
but can you are there other any areas that you do need help from our community, so that if they, besides voting, that they might be able to reach out to you? And
PAL is built on volunteers. So if anybody, it is, picture your story. Are you recently retired? Are you realizing you have an extra 2 hours in your week? Or do you have a special talent that you thought you want to share? The answer for us is come talk to us. We want to learn about that. We've had everybody from unicyclists to guitarists to everything in between.
Yep.
Just anybody that wants to, that is interested in contributing to their community. If it's not us, we're pretty good at connecting folks to another organization. So that's the number one thing. If somebody out in the community hears this and they are into podcasts, hey, we're starting a podcast.
We know
Come
a
on.
person.
Bring it on. You want to come talk to us about your equipment for an hour? Because we have some stuff we don't know how to use yet.
We also know a
that's it.
person.
We've built, PAL is built on volunteers coming up with an idea, or a youth coming up with an idea, and then we just pair up those folks, and that's how we built the program.
Again, all about kids and community.
That's the focus.
Yeah,
The young people are they're gonna run our neighborhoods.
that's right.
It is inevitable.
Yeah.
So let's give them the right skills. Let's feed them along the way, incentivize them, have some fun, blast some music, have some fun, bring some police officers into it, have some good conversations about how to help your community, and keep on moving forward.
I love that. All right. So that's pretty much. Do you have anything else that you want to share, Sean, before we close?
I'm just so impressed with this place. Great backdrop, the plants.
I've got a feeling we're going to be moving the studio over to the Nashville PAL area, but that's
Bring it on.
Well, thank you so much for coming
Appreciate
in. We
it.
do appreciate you sharing all about Nashville PAL today. You guys are doing great stuff for the city, and we really appreciate all of your efforts.
Same. Back to you, Terry. Great.
Thank you. All right. Thanks, guys.
Welcome to this exclusive interview with Randy Stevens, the Executive Director of Hope Recovery. Hi, Randy. How you doing?
I'm doing wonderful. How are you?
Good. Doing well. So we want to take some time to just give you an opportunity to share about your organization, your mission, all of that for the listeners. So let's just start off right off the bat. What's the mission of Hope Recovery?
Our mission is simple. It's to connect people to recovery through community.
Okay. How long have you been a part of the organization?
So I have been working since March 18th, 2024 as the executive director. Prior to that, for about 2 years, I ran a clinic in there just voluntarily doing ear acupuncture for 2 hours a week.
Really?
To give back to the community.
Okay. What drew you into being a part of this?
Well, in 2021, a mental health clinician that I worked with at the Mental Health Center of Greater Manchester he stopped me in the hall and he's like, "You ever heard of ear acupuncture?" And I was like, "Yeah, actually, I received it one time when I was in early recovery." And he's like, "Would you want to learn how to provide that service?" And I was like, "Absolutely." So he brought me to Hope. I did a training in the back with a woman named Laura Cooley. She taught me everything I know about acupuncture, ear acupuncture, and helped me to get certified with the state and provide services. So my way of giving back was run a free clinic, and because they gave me that training for free. Wow. And so I figured give back to the community, and so I ran a clinic there. I met so many people that I was able to connect to recovery and to housing, into the mental health center at that point. And it was so rewarding. And I was like, when I got to Hope, I was like, we need to make this a permanent thing. And then and so our wellness clinic kind of evolved out of that. And Sharna is our wellness coordinator. She's a licensed massage therapist, a Reiki master. She's an ADS, which is an acu-detox specialist like me. And we provide a ton of holistic wellness services for free to the community. We have community partners who gather and come and bring groups for free to some of the most vulnerable. And, at some points in some of these people's lives, they haven't had, love like that. They haven't had, things without expectations, not being moved around, not being objectified. They are welcomed and touched and loved without expectations or without
judgment, maybe?
Judgment, yeah.
Yeah. It kind of gives them a place where they can feel like they belong.
Yeah. I get that a lot. People tell me that I feel safe here. And it warms my heart. It's what I've been trying to build. Is an inclusive environment where people can just love each other without judgment, without expectations, just be normal people and just live together.
Yeah. How many people does your organization serve in the community?
So within a week, we see 800 to 1,000 visits from our members, and that's what we can quantify with the groups that we count, the services that we can count. But it's a drop-in center from 11:30 in the morning until 9 at night, Monday through Saturday. So there are people who come in, and we don't get to count those services. So people come in, they just chat with somebody for a little bit, they find community there, they maybe do a little bit of art, they might pop in the wellness clinic and just sit and listen to the soft music and meditate, and we don't count those people. So I mean, it's probably grown.
Upwards of more, yeah.
These are numbers that, I'm a year behind on all my numbers, because at the end of the year, my data and information manager brings that to me and he says, look what we did last year. And
wow.
So these are, and now I go into Hope, and it's like, with all the community outreach that we've been doing and the way the community's embraced us, I mean, the fire department gave us a car.
Wow.
Yeah, we have a Hope car. We buzz around and provide services to people out in the community all day.
Awesome.
It's incredible.
Wow.
And ever since then, our slow day, there's still probably 20 people in the building,
wow.
at that moment, right? And
yeah.
people just come and go, and it's just a beautiful thing.
And you're based in Manchester, right?
Yep, 293 Wilson Street. We're the old Hoyt Furniture Building. So we're the bottom. It's Suite 101, so it's the bottom left side, and it's like when you're driving along Valley Street and you look to the right and you see that building, that whole side of the bottom floor. That's
wow.
us. Yeah.
Okay.
8,600 square feet of.
Now, how long has Hope Recovery been around?
Since 1999, they formed the nonprofit. It was officially, I believe, the Secretary of State formalized it in 2000, and then 2015 they became they were operating over the phone and in people's homes, just kind of like a mobile peer support kind of service, as known as Friends of Recovery New Hampshire. In 2015, they became Hope for New Hampshire Recovery. So it's Friends of Recovery in New Hampshire doing business as Hope for New Hampshire Recovery. And we landed on Central Street. We stayed there for a year or two, and then found our space that we're in right now. And this year, we finally purchased that space, so we're a permanent staple now.
Nice.
Yeah.
Nice. Your home base.
Yes, that's our hub.
Cool. Yeah. Cool. So, how has working with this organization impacted you personally? Is there a story you could share with the listeners? Maybe touched you?
Yeah, just the ability to, come in and serve, the 2 hours a week that I spent on Wednesday nights at Hope, where that is what fueled my recovery. I don't do recovery the way that most people do recovery. I do what's called a self-management pathway. Okay. So I'm really it's a lot of solitude and taking care of myself. Okay. And it's really important to connect in recovery, especially for me in my recovery, and for many people that I work with. Building those connections is really, really important. So having that space. So Hope, my predecessor, Keith Howard, gave me the opportunity to serve in that way. And I'm seeing people come in now that I served years ago at Hope with ear acupuncture and kindness, who are thank you, and so grateful, and just they're in our community, they're still thriving. That fills my cup like nobody's business. This is the most rewarding thing I've ever done in my life.
This is your passion.
Yes, it is.
I can tell. I can sense it's your passion right now. Yes.
It's making me emotional.
Oh, that's great. Do you need a...
I'm good.
You're good.
I'll slip it back
wow. Well, we're talking to the right person, that's for sure.
Yeah. I'm kind of Hope's #1 fan.
Yeah. Well, that's great. Yeah. I mean, that's why you're doing what you're doing.
Yeah, absolutely.
So you said that there's a wellness clinic and a health clinic. Is that majority of what Hope does, or?
It is a piece, a large piece, because we're able to, especially to our nonprofit partners, go out and provide mobile wellness clinics to staff who are serving other parts of the populations that we serve. So I love the fact that Hope gets to go out. We put on wellness events for staff, so people that are serving and helping now get to be helped a little
nice.
Bit, right? And so we did that. We did it also with Primary Bank, UNH. So we went and served all the students at UNH. Both on the Durham campus last year and the UNH Manchester campus. And then, we've gone out many times providing that service to families in transition and other partners, other programs within our building as well. And it's a really great service that we provide. It's not the totality of Hope, though. I'd say the majority of the work that we do is the one-on-one peer support or the group peer support. So connect, somebody with lived experience who's trained to strategically use that to make connections and create mutuality with people, they sit with them and they coach them through their goals. And some of it's like just literally sitting with somebody and you're an emotional support for them, right? Listening, validation, like that's what people need. They need to feel that connection, and so that's what my coaches provide. We do a lot of training in house. We've recently launched our training program, so now I'm training next generation recovery coaches. I've been doing it for years on other platforms, but now we're finally doing it at Hope. And then also, we have live-in recovery sports, so we have 26 beds for people to live in our various locations and provide, they get programming at Hope if they want. They get, built-in case management, a lot of extra support, and we do things in a very individualized fashion. I've learned through my journey that no two people are the same.
Yeah.
So if I try to create programs that you have to fit into, I'm setting you up for failure. So I want programs that fit around you and wrap around you to help you get to where you're trying to go.
Yeah. Awesome.
Yeah.
That's fantastic. It sounds like you have a lot of people who have been through the programs who then turn around and pour themselves back into it, right?
Some of our greatest staff members, Rod, and it's funny. I have 16 staff, and I'm like, as I'm saying that, I'm like, they're all that great. They're all amazing individually. They're just in collectively.
You can rave about them.
Yeah, and Rod, he's a great example, and he tells this story all the time, so I know he won't have a problem with me saying it. But he's like, I came to Hope in December of, I think it was 23 or 24. It was December 24, and he never left. Like, wow. It was 23 because, yeah. So 24, we hired him, and now he's our peer services coordinator. He's a staple. Everybody knows. Rod is the guy. They wrote the union leader wrote an article about us, and they called him the linebacker. And he's a giant of a man, super kind, super
awesome.
Nice. And you look at him, you're like, whoa. But he's actually like, he's butter. He's nice.
That's great. Yeah. I feel like that probably contributes to your success as an organization, because you've got people who come alongside those who've been through it. And they're like, we're here to work with you. We've been there. We know what it's like. You're not alone. You're like the guide alongside, right?
Yeah, you just described the power of peer support.
Yeah.
That's what it is. That ability to connect with somebody and walk alongside them. We're moving towards something. Right?
Yeah.
We're not identifying problems. We're strength based. We're solution focused. We hear, we validate those experiences, and then we're like, okay, now where are we trying to go with this?
Yeah.
Right. And we the great thing about being a coach is you get to wear hats of like coaching, which is like motivating, right? And then you get to wear the hat of like just that kind, loving, emotional support. And we get to. No two people are the same. Everything's a new experience. Like it's so unstructured, yet there's like. We follow structure, right? It's an evidence-based practice, but it's so like I'm also a mental health clinician, so like I wear that hat, and it's a very structured hat, right?
Yeah.
Like I don't use my lived experience to connect with people, and that way I guide people through therapy, right? So it's a completely different experience when I make that connection with somebody through peer support. Far surpasses anything I do as a therapist. It's incredible.
That's fantastic. Awesome. Okay, cool. So if someone's interested in getting involved, whether they're seeking help and they're looking to Hope for help, or someone wants to volunteer, do you provide options for both?
Yes. We on our webpage, which is recoverynh.org, you can find ways to connect with us as far as like if you want to just give, there's financial ways to give financially. If you want to give as a volunteer, you can come and sign up with Lonnie. He's our center manager, and get in our volunteer program. We have a volunteer liaison program to help people develop skills to transfer into the workforce as well. So
nice.
There's like a little piece of, for those who aren't maybe necessarily work ready, there's come and volunteer with us, and we can help you get work ready. We partner with various other like Granite Pathways and various other organizations to provide extra services for our volunteers. But nice. If you're a volunteer and you have a lot of skills and you're just looking to give back, connect with Lonnie, and we're like, for us, it's not like we have all these things that you could do. Sure, we want to know what you want to do, right? Like we want people to be bought in and want to show up and help. So there's so many options, and this, we have everything from, when we're doing big community events and just setting up and breaking down, right? Like when and I do want to put a plug in for a concert that's happening, and that's all I'm saying about it. My design team my creative team would probably lose their mind if I even they knew I said that right there. There's going to be, if you follow us on social or you're looking at the webpage, you're going to be able to see some really exciting things happening, and it's going to be really beneficial for the community because it's all free.
Wow.
And it's a big community event. There's going to be several like this coming every year. We have our fundraiser during September. We have our gala in May, and now this is going to be an event that we can get together over the winter in someplace warm. And
Very cool.
yeah, be
Okay.
together.
So to anyone listening, check that out.
That's right.
Check back. Awesome. So what would you say, if you could sum it up, what's the greatest value that you believe your organization provides the community?
Connection.
Yeah.
Yeah, we have a place, we have a way of connecting and a place to connect with people that that I don't think is lacking. It's special. It's unique.
Yeah. It's like a family,
Yeah,
right?
it really is.
And you've seen the environment transform, I'm assuming, like while you've been...
Yeah, I've poured a lot of love into the people pour a lot of love into the other people, and that ripple effect has just been incredible to see. Like, and I'm not taking the credit for it. I just know that if I'm leading it, right, I'm leading in which direction we're going, and that's the direction, is like lean into the people around us, like pour as much love into them as possible, surround them with love, and like, and that honestly, it increases the value of our community and of hope. The value of hope is increased simply because we are investing in our people.
Yeah. Awesome. Well, thank you, Randy, for coming in. Really appreciate you taking time, sharing a little bit about your organization with the listeners. To everybody listening, remember, this is a campaign where you get to vote for which organization you want to receive the top donation from Triangle. So if you like what you heard, make sure you vote for Hope Recovery.
Thank you.
Thank you, Randy. Thanks for tuning into this episode of the Making Money Personal podcast. If you enjoyed today's show, we'd love to hear from you. Send us an email at tcupodcast@trianglecu.org or reach out to us on social media. Thank you to all of our subscribers, and if you haven't yet, hit that subscribe button so you don't miss out on any new episodes or money tips. Thanks again for listening, and have a great day.